Distinguished guests, colleagues, ladies and gentlemen, good morning. Welcome to the World Health Organization Regional Office for the Western Pacific and to our celebration of World Health Day 2019. My name's Olivia Law-Davies and it's my pleasure to be your MC for today. I'm standing in for Angela Pratt, who's unfortunately lost her voice. World Health Day is the anniversary of the founding of the World Health Organization. We celebrate our birthday by raising awareness and mobilizing action around a global public health issue. This year, we focus on universal health coverage, and in particular, on primary health care. This is a long-term campaign aimed at ensuring that everyone, everywhere, can access the essential quality health services that they need without financial hardship. To start our program, may I now call on Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific, to deliver his World Health Day address. Dr. Kasai.
Esteemed representative of the government of the Philippines and diplomatic corps, development partners, NGOs, UN colleagues, friends from media, distinguished participants, ladies and gentlemen. Good morning and welcome to WHO Western Pacific Regions. And thank you very much for joining us here this morning. WHO is a UN specialized agency for health founded 71 years ago with the mission for seeking highest possible health status for all people. For those who have been here for the first time, this is one of the 6 regional offices around the world, and we serve 37 countries and areas in the Asia and across the Pacific. The World Health Day is actually the birthday of WHO. In the course of course, celebrations for the progress that the entire world made towards the better health in the past 7 decades. But it is also the time to reflect how far we have to go from today. And this year's theme is the universal health coverage. That means everybody, everywhere, being able to receive the services, health services that they needed, when they need it, with affordable price. And this year, particularly, we wanted to focus on the primary health care. Speaking about primary health care, you might be wondering, what is this primary health care? The primary health care is the basic health services close to where people live. It's where people visit when they have minor illness. It's where people get vaccine. It's where mother and child get their regular checkup. Just last week, I was at Vicencio Health Center, just down the road from this office in Metro Manila. And I see nurses and midwives providing services to the pregnant women. And I talked to them. And soon-to-be mother were all very happy with the services they're receiving, knowing that services will bring to the new babies a very good start of their life. Primary health care is also an interface to the community. I was in Samoa, the middle of the Pacific Oceans, and I visited one of the remote villages called Sanopu, where I met a very passionate special women groups. These women groups is so passionate and be known as the leading women's group for providing the services called PEN-FA Samoa. This is the activities to help the villagers know their status about their blood pressure level or sugar level and the risk of diseases such as hypertension, and diabetes. I was so impressed by the way they care their community and also their commitment to try to help and make their community healthy. Primary healthcare in some countries, in some special setting, is also the only services that people can access. A few years ago, I was a WHO representative in Vietnam. And I had a mission to the northern part of the country where hard to reach area existed. On the way back from the field, it was already late at the night when I encountered one village. It's so dark. So it's only the light of the car showing the road. But there's one light on along the street. And I become very curious. What is this light? And I visited. It was health center. And there one nurse there. And I asked, this is already late, what you're doing? And she obviously looking very strange to my question. And then she said, I'm here because people might come. I was very touched about that response. Of course, it was Vietnamese, and then it was translated to English. But I'm very, very impressed. These are the actual stories, an example of the primary health care in action. And of course, this is not a revolution. This is actually not just a three example, but there are so many examples around the world. And you may notice that this primary health care concept is not the revolutionary one. But the truth is, in the past, the health investment was not enough for the primary health care. If we compare to other intervention in health, such as the hospital. And today is the day that we need to correct this. Actually, we don't have to be rich to organize a very good primary health care. And the truth is, it is a smart investment for the government. The reason is actually very simple, because primary health care keeps people healthy. Let's take the example of maybe type 2 diabetics. This is the chronic condition, but if you receive constant monitoring, medications and advice and intervention, you can continue to spend your life as normal people. And primary health care is a services that you can offer those services close to where you live. But again, the truth is, there are some countries, only half of the populations have access to this primary health care. And the truth is, if you don't have access to those primary health care, those health services, you may end up with a disastrous consequence. Let's say if it's diabetics, type 2 diabetics, you may lose your eyesight. You may need a dialysis. You may need to amputate your leg or foot. Of course, this is bad things for the individual patients, but it is also costly. This is the reason why we think it's a smart investment for the government to the primary health care. And this is why we think it's a time to revisit the primary health care, the meaning of the primary health care, and strengthen it, both in the health of the people and in a more productive society. Excellency, over the last few months, actually I took this office in February. I went around the country and I have exchanged with the minister, permanent secretary, and the senior officials and discussed what will be important things for us to focus in the coming 5 years. 3 things came up. One is that the health security. As you know, this region is known as a hotspot for the infectious diseases. Past 3 out of 4 influenza pandemics start from this region. The second issue is the diseases I just mentioned that people are anticipating increasing towards the future, such as the diabetes. And some countries also express, please also combine that with the rapid aging. And of course, many of our Pacific Island countries express their strong concern about the health impact of the climate change. And some other countries also express about the environmental health issues in relations with the development. So we're now discussing with all the member states, these are the three things we're going to focus. But then we realize one thing again. UHC, through strengthening the primary health care, is going to be the key to address those three areas. Ladies and gentlemen, and distinguished guests, tens of thousands of primary healthcare workers across the regions are hard at work as I speak. Like the women I told you about in Samoa, the healthcare workers in remote village in Vietnam, and the antenatal staff here in Manila, and countless others. They are already dedicating themselves to serving their communities, but they need acknowledgement. They need resources and support to ensure that they can deliver. And unfortunately, for each example of great primary healthcare services, there is a community somewhere else missing out. It's time to fix. This World Health Day, we are calling on leaders and partners to join us to strengthen primary healthcare and deliver for all. Thank you very much again, and happy World Health Day. Thank you.
Thank you very much, Dr. Kasai. So as Dr. Kasai said, primary healthcare is an investment in the future. And he also mentioned that our regional office, for those who don't know us well, covers 37 countries and areas. It stretches from Mongolia and China in the north and west, to Australia and New Zealand in the south, and all the way to French Polynesia in the east. We are a region that's extremely diverse and incredibly dynamic. So to help show why universal health coverage and specifically primary healthcare are so important for countries in our region, we'd like now to invite two of our colleagues here in the regional office, Manu Arali and Fukushi Morishita, to explain a little bit more about some of the future health challenges here in our region.
Good morning, ladies and gentlemen. Good morning, distinguished guests. We will spend a few minutes with you to basically show how our Western Pacific region is changing today and in the future. And we have brought some graphs, some data with you. I promise we will try to make it interesting. And so the key message is our region is really changing quite rapidly. We see this in many different ways, geographically, socially, economically, and obviously also our environment, as mentioned by our regional director. One way, obviously, to show how our region is changing is to look at how the economy is doing. And I want you to look at our graph here. See how since the 1980s, the economies of the Western Pacific region have become stronger and bigger. If you look at the graph, you see countries like Brunei, Singapore, very strong economic growth in the last couple of decades. But even countries like Malaysia, Vietnam, very strong economic growth. And in most cases, of course, health means wealth and vice versa. This is very, very positive. And so we are seeing that the people and the lives of the people are getting better around the region. However, the picture is not always that rosy, because we do see that, as already mentioned by our regional director, some communities are missing out. And one way of showing this is to look at the Gini coefficient, which is a scientific way to show how much income inequalities there are. Obviously, you see, you might recognize your own country or some of the countries in the region. And let's look, for example, at China or the Philippines. They have really like quite a high number of income inequality still. And in some countries like China, it is still on the rise today. In the countries like Philippines, it has sort of leveled off as we move forward. Okay, so we see that countries and economies are growing. And of course, what this means is like people can live longer because they're healthier. And one way to show also this is to look at aging population. So the aging part of our demographics is the most rapidly changing part. Like we see that like in our region, there's a huge number of people in the coming decades that will be over 60 or 65 years of age. And let's look at the graph. We just have to go back once. And this is a graph over the last 100 years. And please look at a country like Vietnam. It says V and M, and a country like Japan. Japan, we all know it's a rapidly aging society. This is very well documented. But look at Vietnam, a country like Vietnam. In the next 2.5 decades, it will have a huge spike of elderly population. So this means that these countries have much less time to prepare for an aging societies and the challenges of an aging society as we speak. And so, yes, people are living longer, and that also means that like we are confronted with different sort of diseases. And that is an important fact. And obviously also, we do see an incredible rise in what we call non-communicable diseases. Economies are growing, but lifestyles, unhealthy lifestyles are unfortunately on the rise. And we do see that like people do become more obese, they do consume more alcohol, and unfortunately we also do exercise as a region less. However, I think there is a bit of a glimmer of hope. In the last couple of decades, we've worked very, very hard, your countries and the WHO, to push back on smoking. And we do see that smoking rates are actually on the decline. So that's really, really positive. And so what we say is that like, if we can reverse the trend on smoking, we surely can do it for other risk factors as well. Okay. And obviously, if unhealthy lifestyles are on the rise, we know that this correlates very, very much with the rise in non-communicable diseases. And I want you to look at the graph, see what has happened since the 1990s for the last 3 decades. We see, because our region is changing, and we are getting more and more on top of tackling communicable diseases, infectious diseases, such as measles, such as HIV, TB. We do get more and more on top of those. But if you see in the next couple of years, there will be more and more NCDs. And the percentage of total deaths of NCDs will reach pretty much 80 to 90% in most of your countries. And so that in itself presents different challenges and different ways of dealing and tackling diseases and our lives. Okay, let's move forward. Lastly, I want us to focus on an important topic, and that's climate change. It's very much in the news, and we know it is a topic that is very much to all of our concern, and probably the topic whereby we haven't really seen the impact that dramatically in most of our lives. However, the data is really showing that in the last couple of decades, there is a steep rise in, and particularly if you look at the right-hand side, floods and storms. And floods are something that becomes more and more common in the Asian part of our region, whereas storms is something much more frequent in the Pacific part of our region. So again, this is a very important change that will continue to change, and we need to continue to tackle this. And what we're trying to say here is that like primary healthcare, UHC, is really our rock. In spite of all these challenges, primary healthcare can provide an important response, first line of response to any of these changes that we're seeing, whether people are affected by an emergency, whether people need follow-up for their chronic diseases. It's very important. And we say health for all. It can be done if we strengthen our primary healthcare services. Okay, so this gives you a bit of an idea of how our region is changing. And hopefully for the rest of the program, you'll learn more about how we can more operationalize this and look more into all of this. Thank you very much and enjoy the rest of the program.
Thank you very much, Manu and Fukushi. So the data that you've just seen tells one part of the story. But of course, the most important part of the story is people. A few weeks ago, we asked WHO staff across the region to go out and talk to real people in the communities in which they serve, to better understand the challenges and realities on the ground. The stories that we heard through this exercise were incredible. We want to share with you now just 3 of those stories by asking some of our staff to step into the shoes of the people that they met through this exercise. Starting here in the Philippines, I'd like to ask our colleague Albert to introduce you to 5-month-old Caleb. Albert.
Hello, I'm Caleb. I'm from Manila, Philippines, and I'm just 5 months old. Right now, I'm in the hospital. You should have seen the panic in my mom's eyes when I started struggling to breathe. I had rashes all over and high fever. My skin darkened as I gasped for air. I got measles from my older brother. He did not get his measles vaccination because mom said there was no supply of the vaccine when she visited our health center. She's been busy at work, so she didn't have time to go back again later. Why did they not vaccinate my brother so I am protected? My future has been compromised by an old epidemic that should have been eliminated by now. If we want to prepare for a healthy future, my future, we need to get rid of the old problems.
Thanks, Albert. Now we're going to go to the Republic of Korea. And I'd like to ask our colleague Minju to introduce you to 17-year-old Yoon Jong.
Hi, my name is Yoon Jung. I'm 17 years old and I love K-pop. I go to school from 8:30 in the morning to 9 p.m. at night. After a quick snack, I rushed off to my afternoon classes. My mom says I need to study hard if I wanted to get into good colleges. I'm always feeling stressed and tired because of the long study hours and competitive exams. I want to stay healthy, so I walk to school and exercise in the park, but the air quality has been terrible lately. It makes me cough and it irritates my eyes. I wish I could talk to somebody about my anxiety and feelings, but I don't want my parents or friends thinking I'm crazy or weak. Is it true that in other countries, you can seek mental health services without stigma and it's all covered by health insurance? If that would happen for high school students like me, that would be awesome. Thank you.
Thanks, Minju. Finally, we're heading to the Pacific and specifically to the Solomon Islands. And now I'd like to invite Overly, who's actually not one of our staff, but a student from the Solomons studying here in Manila. And he's going to introduce you to 48-year-old Kisina from his country.
Hi, my name is Kisina. I'm 48 years old. I come from a small village in Malaita province in the Solomon Islands. I moved to the city to find work. It was a hard decision, but I had no choice. I need to make money to support my 5 children. Now, I'm a taxi driver. I work more than 12 hours every day, but I am happy to do it. I want to pay my children's school fee so they can get a good education. Life in the city is expensive, but my wife and I try to buy healthy food when we can afford it. I try to stay healthy. I don't smoke or drink alcohol. I sometimes worry about what will happen if someone in my family is sick. Last night, my uncle wasn't feeling well, so I took him to the hospital. But there were no beds for him, so we had to bring him home. I don't know if there's anything I can do about the health issues in my country. I'm only one person. I just work hard and hope a brighter future for my children. Thank you.
Thanks, Oberle. Obviously, this isn't a representative sample of every country and demographic in our region, but we do hope it gives you a taste of the realities that people are facing on the ground. So how does all of this relate to primary healthcare? To answer that question, let me now turn to Dr. Peter Cowley, who's our Acting Director of Health Systems here in the regional office. Peter.
Thank you, Liv. As we've seen in the earlier presentation, this region is incredibly dynamic. It's changing in terms of socioeconomic growth, its aging profile, its exposure to the effects of climate change, and the role of non-communicable diseases. We also see that there's so many health-related challenges for many of the people in the region. These challenges and needs are so diverse, but a key component in addressing them is primary healthcare, or PHC. Think about it for a minute. Primary healthcare should be people's first point of contact with the health system. It ensures that children are vaccinated. Young people feel comfortable about asking for information on sensitive topics, such as family planning. It also supports mothers through pregnancy and helps them and their babies in their new routine after birth. Even as one gets older, which happens to a few of us here in the audience, primary healthcare helps to prevent patients from becoming diabetic or delay the serious complications of diabetes. Even towards the end of life, primary healthcare is there, helping to support the patient and their families during the transition. Primary healthcare is the foundation for universal health coverage because it's accessible, it's equitable, and adaptable. Adaptable to what is happening in terms of socioeconomic growth, aging, the rise of NCDs, and climate change, but also accessible and adaptable according to the unique needs of patients, families, and their communities. One country among many in the region that highlights the importance of primary health care is Vietnam, with their grassroots health reform efforts. These efforts are community design, led, and implemented using a bottom or bottoms-up approach to planning and implementation. The following video shows you how primary health care using a grassroots approach works in Vietnam. There's always a line in that video that strikes me, and I feel very comfortable here. I'd also invite you to take a quick look at another country, which also is very deeply involved with primary healthcare, and we turn to Beijing, China.
So thank you very much, Peter. It was great to see those stories from a couple of the countries in our region. Now, to dig a little deeper on how countries in the region are working towards universal health coverage and stronger primary health care, I'm going to turn over to Dr. Gundo Weiler, who's our WHO representative to the Philippines, and he's going to moderate a short panel discussion. Over to you, Gundo.
Yes, thank you, Liv, and good morning to all of you. Now we've looked a little bit at the big picture, at the big data. We've seen the challenges of the future for this region, and we've heard why primary healthcare is so important. So now we want to have a quick discussion and explore how universal health coverage and primary healthcare actually can play out in real life, in a real life setting. And for this, we are going to zoom in on the Philippines, not only because we are here and because the Philippines is such a wonderful host to the Western Pacific Regional Office, but also because the Philippines is a very interesting example of a country and the struggles and also successes that the country experiences while moving towards universal health coverage and a strong primary healthcare system. So we've got the privilege to have a panel with us of 7 guests, 7 eminent guests that will all provide distinct perspectives and experiences on primary health care and universal health coverage. And I'll quickly introduce our guests. I will start here on the left side. We've got 5 guests from the Philippines. First, we have from the Department of Health, nobody less than the Chief of Staff of the department and Undersecretary Dr. Eric Domingo. Thank you for joining us. We've got with us on the other side of the spectrum of care a patient, Ms. Gina Javier, and I can say a real expert patient. Ms. Gina has been living and receiving treatment for diabetes for more than 30 years. So you know what you're talking about, being a patient. Thank you for joining us. We've got two healthcare providers with us, two doctors who take care of patients such as Ms. Gina, also for many years. We have got with us Dr. Paz Herrera, who is a physician in charge of a primary healthcare facility and lying-in clinic. That's where women give birth. Here in Manila. Thank you for joining us. And this is a public facility run by the Department of Health. We also have a doctor with us who is overseeing an expanding network of privately owned public primary healthcare facilities, Dr. Michael Santos. Thank you. And we have with us very importantly, Dr. Israel Francis Pargas, or short Dr. Ish. Dr. Ish is from the PhilHealth, the Philippine Health Insurance Company, and of course giving very important contributions, and we'll hear from you as well. So these are our guests from the Philippine side. We also have two ambassadors with us who volunteered to provide a perspective from the outside of the Philippines. First of all, Excellency from Brunei, the ambassador from Brunei, Dar es Salaam. I'll try to pronounce your name correctly. Her Excellency Joharia Wahab. Thank you. And easier to pronounce, not less important, His Excellency, the Ambassador of Australia, Ambassador Stephen Robinson. Thank you also for joining. So, long introduction, exciting panel, exciting perspectives. Everyone has something to contribute, and we are looking forward to a vivid exchange. And we will I will start kicking off the discussion by turning to our Undersecretary, Eric Domingo. Now, you probably, you all live in the Philippines, you probably all follow the news. There's been a lot of media coverage recently on a very important law, the Universal Health Care Law. Universal Health Care is the Filipino version of universal health coverage, and that was signed into law only 6 weeks ago by the president. And this has really been praised as a landmark piece of legislation, rightly so. The Philippines is one of the first countries in the regions that has an explicit UHC law. Now, interestingly, universal health coverage is not a completely new invention and idea. And actually, the Department of Health already put out a health agenda in 2010, so 9 years ago, that was called Achieving Universal Health Care for all Filipinos. Now, my question to you is, why a law now? Why is the law important, the UHC law? And how do you think that law will advance access to universal health care and to primary health care in particular?
Yeah, thank you, Gundo, and happy World Health Day to everybody. You know, the Philippines is very excited. It's our first World Health Day with the universal healthcare law actually signed by the president, and we're working on the implementing rules right now. The Philippines have always wanted to have universal coverage, and we've been quite successful, reaching 91, 92% in the past years. But this law now enables us to have universal coverage, meaning every Filipino by virtue of birth is now a member of the National Health Insurance Program. So it will reach everybody in all corners of the country. And it will be funded by several means, by personal contributions from people who work, by taxes, by money from the lottery and from gaming, and more importantly, by money from sin taxes, taxes on tobacco and alcohol, which, by the way, we want to increase even more towards the end of the year. So the Filipino has always been afraid of going to the doctor because it costs a lot of money, but the coverage of PhilHealth will now include both inpatient and outpatient benefits. So there's always that fear. We hope to remove that fear. The Filipino does not want to go to the doctor because they don't want to find out that there's something wrong with them, because they probably could not afford the treatment. So now with this financial protection, we hope to change the way that people seek care. And I think the second more important part is really the focus on primary care. 60 to 70% of Filipinos actually skip the primary care level and go to the crowded hospitals that we want to avoid, congesting our hospitals with severely ill people. And we hope that once we have that primary care setup ready, with every Filipino and every family assigned to a primary care physician right there in their community, we're going to catch the diseases early, we're going to have preventive and promotive activities, and we're going to have a healthier people and decongest our hospitals. So we're really very excited. It's going to be a lot of work, and we're going to need a lot of cooperation and help from everybody, but I think 2019 and 2020 would be very, very good years for the Department of Health.
Thank you. Yeah, this is really a very exciting moment in time, and you have a lot of work ahead of you, and we'll be with you, of course, and support you the way we can. Now, you've mentioned two aspects that are really quite important and that are very much in line also with the global push towards universal health coverage, which is on the one hand the financial aspect, so that people are able to afford services, but then also the aspect of accessibility of services, and particularly accessibility of services through a good primary healthcare approach. Now, maybe we can dig a little bit deeper here and explore a bit how that experience plays out in real life. And I would like to turn to Ms. Gina. As a patient, you're probably the most experienced one who can talk about that. And let me just maybe introduce you a little more. I've mentioned you live with diabetes. You've been diagnosed of type 1 or juvenile diabetes at the age of 19. I can say I think that today you live a very full life. I learned you've got 2 daughters, you have a family, you are an active diabetes patient trainer, and you're even co-leading a mountaineering club. So you have a full life today, but I can imagine that was a long journey to get to that point. And maybe you can share with us a little bit your patient journey, how it all started, and how you found out about your condition, and how you were able to get on treatment for your diabetes.
Yes, good morning, everyone. I was diagnosed with type 1 diabetes October 1985. But at the time, I was in college and very busy. We thought that it was just an overfatigue because of the very busy college activities and requirements in school. But my boyfriend, now my husband's mother, advised me and brought me to a doctor, their family doctor. And we found out, the doctor asked me, they checked my blood sugar and the result was above 800. So I was admitted, I was advised to be admitted, but unfortunately there was no room available at that time. I had to wait until the late night to have an available. I was admitted at that time, then late night already. And then during that time, my journey was the education about diabetes. I didn't realize that diabetes is such a hard, or you have to know your disease. And at that time, there was no one to teach me or give me knowledge about the disease, the diabetes.
I think that's a very important function that you are talking about, that it's not just about going somewhere in the first place and then being sent somewhere else, but having someone to trust and to work with over a long period of time who can accompany you in taking care of your condition. So that was at the time, I think you were probably sent around from A to B, that something that we see quite typically. How do you think that plays out today? How do you manage your condition today? And I know you're also in touch with many different diabetes patients. How do you see this today, access to coordinated care and the role of primary health care?
At this present time, we are lucky to have advanced technology, and we have support groups like PAPU and a Rainbow Camp. We have a Rainbow Camp that we care for. I'm a part of a board of director that we care for type 1 kids and adolescents, and we conduct camps that I see that it would help even me to learn more about the management of diabetes.
Right, great. So that is really important, and that primary healthcare is really much more than just seeing a doctor. And it's about many different players coming together and together being able to support patients in their different needs that patients have. So thank you for sharing. We'll get back to you a little bit later. But I suggest now that after this patient perspective, we turn to a perspective of those who are carers, who are providing primary healthcare services. And maybe I can turn to you, Dr. Herrera, as the physician in charge of a primary healthcare clinic. And so what we heard, in the ideal world, primary healthcare is the first, of course, the first point of contact. And then is a location, is a place where people can get comprehensive care. And if they cannot receive all the care that they need, that the primary healthcare center can act as a navigator for the patients. So that's the ideal scenario, but what's the real life like? Is that a role that you can easily take on, or are there still challenges that you're experiencing?
Good morning, everyone. For the primary healthcare at our level at the LGU, it's a protocol on us. Once the patient enters our clinic, there's a risk, especially if the patient, we get some history taking to know what's the signs and symptoms being experienced by the patient. Then there's this NCD risk assessment form we apply to patients 25 years old and above. So we screen patients for those non-communicable diseases. So for the case of Mom Gina, a part of that risk assessment is you get the vital signs, the graphic socioeconomic profile of the patient. Then we assess for risk factors, the modifiable, if it's a smoker, alcohol drinker, the lifestyle. Then once it is, the doctors assess the patient for any risks for that. So once it's there, we try to work up the patient through laboratory diagnostics. So with that, then we had a final assessment for the patient if it's really what the case, especially for example diabetes for that matter. So fortunate for us, the primary healthcare at this time, the Department of Health together with the LGU is helping each other, providing meds. Although not that enough meds, say for example, for diabetes, we have supplies of metformin. For the insulin, there are some specialized health centers that are given supply for that, although it's not continuous. So for the case of Mom Gina, a type 1 diabetic, definitely oral medications for diabetes is not that applicable. So usually it's on insulin right away. So for her case, way back, definitely it's on the tertiary level, so on the hospital level. So on the primary healthcare, that time, for that matter, maybe that time no insulin yet for supply for us. So for example, for the primary healthcare at this time, having Mom Gina as a patient, right now, non-communicable diseases program is developing to supply us with insulin. So maybe it will be a big factor and a big savings for the patient if they can avail of that at the primary healthcare level.
Great. So I think there are a few things that are really important from what you talk about is that first, you are getting ahead of the curve. So you are in your primary healthcare center already doing a proactive assessment of possible risk factors so that you can discover potential risk before people get sick. So a very important role of primary healthcare that goes beyond treating those who are already presenting with certain conditions or diseases. And you're saying you're also taking on a role that previously was reserved to some higher level facilities, so you can provide more comprehensive care. So we see that the role of primary healthcare is actually expanding. And we also see, I think, maybe a change in the disease profile. Are the people that you see today, are they presenting with different types of conditions than maybe 10 years ago, 20 years ago?
Way back, you realize you assess patients, you diagnose patients late already. They have diabetes with complications. Nowadays, because of the awareness of patients regarding diseases like diabetes through our health teachings at the health centers and even in the barangay level, they are educated and more aware that, say, for example, signs and symptoms, basic signs and symptoms of diabetes like frequent urination, they say as polyuria, frequent drinking of water because you're always thirsty or you're always hungry and you have weight loss. You have probably having diabetes already. So for that matter, patients, because of patients are educated now, they seek consult in our health facility early. So they are diagnosed early then and treated early. So we try to avoid further complications.
So patients know more today, and they also have other expectations from primary healthcare centers, expecting not only treatment once they are sick, but also advice on how to stay healthy. So that's interesting. Let me maybe ask you one last question.
Yes.
Dr. Domingo mentioned that overcrowding of hospitals is an issue. And I've just yesterday been in Mindanao in a tertiary hospital, which was really overcrowded with beds on the corridors and kids sharing beds even because there were not enough of them. And I asked the question, the chief doctor asked the question, so if you look at all of your patients, how many do you think should really be here and how many can be treated in lower level facilities? And he told me, probably half of my patients don't need to be here because they could be taken care of at the primary healthcare level or at the first level hospital. So there are many people are bypassing primary healthcare. And why do you think that is the case from your perspective? Why are some people not coming to your clinic, but going directly to the hospital?
Usually for us in the Philippines, Filipinos have that notion that if they go in a health center, they have to wait in line. So they're impatient as to, we have the protocol to give the, say for example, we have to make a record prior before they are assessed by the doctor. So if they pass by the nurse to have a family record, then the vital signs and all. So many patients tend to, they're so impatient enough to wait on the line for the turn. So one factor likewise is that be it now, they have this quite a wrong notion for government health workers. Now, if you seek consult at the government facility, it's not that quality.
Okay.
So for us at the level of the primary health care, as physicians, we need to boost the services we need. So it's quite an advocacy on our part to promote the community health healthcare that should be served.
Thank you. Thank you. A great answer. And I've got a few notes, but this is not all scripted. So we are just having a conversation. So that's good. And I think we also need to be honest about some of the challenges. And some of the challenges are that the reputation of some services, and especially public services, haven't been great in the past. And there's a real effort to build up and rebuild confidence into primary healthcare. Now, Dr. Domingo, the UHC law you've mentioned, a lot of the effort is, the emphasis is on making services better work together so that people can go to a primary healthcare center and they will feel confident that this is the right entry point because either I'm taking care well there or they will be a good system of working with other entities and they don't need to organize their own referrals. So concretely, how do you think that will help this new law?
Well, what we want really is to have primary care level contact a requisite to access to the health system. We don't want people going directly to tertiary care, to special. Filipino patients usually think that only the specialist or the super specialist is the good doctor. You know? The primary care doctor is given a second-class citizenship here in the country. And what we want to make sure is for everybody to appreciate the family physician and the primary care provider by giving a good working environment, a nice clinic with all the necessary basic examinations available there. And of course, we have to make sure that access to the higher level care must pass through the primary care physician. So I think it's going to be really a major change in the way that healthcare is delivered and accessed in the country. And I think that is the biggest challenge here. It's really making sure that everybody goes through primary care and that primary care is of good quality and accessible to every Filipino.
Okay, great. So really the primary healthcare facility taking on a navigating function. Some people call it gatekeeper, but that's a bit restrictive. We don't want to keep them away, but attract them into health services. And primary healthcare has an important navigation role to play. Now, we've talked about the public services. We also have with us Dr. Santos from a private provider. So because some people, as we know, are bypassing or are opting out of the public system, they'll go to the private system straight away. And there's actually an increasing network. Private clinics we've seen for a long time at the more specialized level, but we have an increasing network of primary healthcare clinics. You are overseeing the development of the family doc network of primary healthcare clinics. And so if you listen to the testimony from a patient and from the public service provider, what's your perspective? How would the same experience be different in your center? Primary healthcare center.
Good morning, everyone. Just to start out, Family Doc is the first private chain of primary care clinics in the Philippines. We're currently operating 60 clinics for now in the greater Metro Manila area, and we plan to end the year with about 80. In terms of experience, I think since it's already in the private sector, our patients are having a better experience simply because we have a lot of efficiencies. So right now, I think the average waiting time of our patients or the average door-to-door time, so from the time that the patient goes in the clinic to the time they pay their bill is about 45 minutes. It's the first time, and we actually have a free consultation guarantee if you exceed 45 minutes of waiting. It's the first time it was implemented in healthcare, and yes, doc, just like a pizza delivery. So, but it's nice. The nice thing about being in the community, so we're placed differently. Our competitors are usually inside the mall area or the business district. We are actually placed outside the gate of your community. So the nice thing about it is we can ask the patients to come back. So if there's already a long line, patients do come back. We believe that accessibility right now is the main issue. Surprisingly, in Taguig, where there is a lot of big providers there, tertiary providers, we have the most number of patients simply because they don't want to cross C5. We're on the other side of Taguig, the City Hall side. So a lot of patients, since they don't want to cross C5, we're starting to see around 60 to 80 patients per day. My doctors are starting to tell me that we're starting to look like a public OPD. But I think the quality of service is there definitely. But I think the issue that Family Doc is addressing is more of accessibility.
So proximity, being close to the community, a very important factor, and ease of access, really. make it easy for people to reach you and then be served also in a short period of time, so that people are not losing out on their work day or other important chores they have to do.
Yeah, we're actually open until 9 p.m. So we have a lot of patients after office.
Okay. So I'm sure there are also many public-run facilities who've done a lot to ease access, but it's certainly inspiring to see, to show the way how primary healthcare services can increase efficiency and proximity to the community. Now, you are a private facility, and then if we talk about private care, we also have to talk about money. Of course, and we've heard that the whole aspect of affordability is a very important aspect in this whole discussion. So we don't want to shy away from that discussion. So can you tell us a little bit, how does it work in your facility in terms of payment, cash payment, out-of-pocket payment by patients?
So currently, because everything is tracked electronically, so we actually have a very good idea of how much our patients spend. So a typical patient, the average basket size of a patient in retail terms is about 1,200 pesos. That would include your consult, basic laboratories, and already the medicine for the week. Plus, we offer a free follow-up for 7 days, regardless of what your condition. So we keep asking our patients, please come back. We just want to see if you got well. So that's a service that we do for our patients, but it's about 1,200. And let me just add that based on our data, 96% of our patients are spending out of pocket. Only 4% are using their HMOs.
Okay, interesting. Dr. Herrera, can I ask you, how does it look at your facility? Are people paying for the consultation?
In the city of Manila, all services are for free. It's the city of Manila provide us with the logistics. So just to have a brief background of our local government, the city of Manila is divided into 6 districts. So districts 1 to 6, each one, a total of 56 health centers are within the community. So the proximity of the health centers with the patient is not a problem. Manila Health Department likewise also has a public health laboratory, although it's located at District 3. So if you're in District 1, there's a difficulty. The patient needs to have fare for the transportation. However, we also have 6 district hospitals provided in all the districts. So accessibility to the laboratories is quite okay with the patients. Medicines, we provide it at the level of the health centers.
Okay.
So it's all for free.
Okay. Well, that's very reassuring to hear. And that's good. But I think you're making an important point. Sometimes there are also costs that are somewhat related to receiving care, but they are not immediately being occur at the health center. So for instance, transportation is an important issue for some who are living far away from health services. And I just want to make a bit of a reality check, Ms. Gina, because you have got your own experience, you're in touch with many others, and we know that in principle, the government, the public services are for free, including the medication. But sometimes some do better maybe in some facilities in enforcing this than others. What is your experience? Have you paid for health services or
Yes.
maybe no? And
Yes.
what typically are the expenditures that
Actually,
you have? What do you pay
as
for?
a diabetic, you need glucose strips. You have to monitor, which is one of the burden of every diabetics, because we have to buy strips to monitor our blood sugar, to know how we will adjust our insulin, and what are we feeling, to confirm what are we feeling. Are we in hypoglycemia or in hyperglycemia? And strips is very expensive. And then we have the insulin. It's lucky if you are an indigent, but me, I'm not. So we usually, other diabetics like me, find ways to buy insulin at a cheaper price.
Okay.
Find ways, meaning we apply for PWD to have a discount, just to have a discount to buy or to have to sustain our insulin requirement. We also have the laboratory test. Laboratory test, I think it's not free with PhilHealth or
Outpatient.
outpatient, no. And before you have a regular checkup, you have a regular checkup. Diabetics should go to the doctor with the regular checkup. We have to have laboratory results. Having done that, it costs us a lot of money before we have to have a result. So the tendency is we sometimes do not go to the doctor for a regular checkup because laboratory, there are HbA1c, creatinine, microalbumin, a lot of tests.
Thank you. Yes, so that is, I probably have a longer list
Yes,
of that, and I think that is the reality, and we need to acknowledge this, that even receiving care for conditions that can be taken care of at the primary healthcare level, some clinics will be better in enforcing free for all access, but many clinics, for their own reasons, will not be able to provide everything. So there are costs that are very substantial because they will be piling up if we go through the long list. And we do know, the statistics say that in the Philippines, there are 1.4 million people every year who need to spend more than 25% of their household income on health services. So imagine 25% of the household income go for health. That is something that we consider a catastrophic expenditure. So that is a reality. And now I'm turning to you, Dr. Ish. You are the vice president and the responsible for health finance policy in PhilHealth. And of course, my question to you is, with the Universal Health Care Act, how is it going to change? How will this act help to protect Filipino patients better from financial burden?
Well, yes, and hopefully that's the expected outcome that we will have in the full implementation of the UHC. But what is good also in the UHC is, aside from, of course, making every Filipino already a member of PhilHealth and there is automatic eligibility, is that it also sets the tone and it sets the enabling environment to make the financing more efficient. And one that now puts PhilHealth as the major purchaser of health services in the country right now. But of course, PhilHealth has to balance its actions in order to make sure that with all the needs that we need to answer, we can also balance on how we will finance and with the resources that we have right now. So what is good also is there is now putting in all the monies for health in one pocket, in one bowl, and that in effect would actually make it more efficient for the system. And now PhilHealth has that major role to do its strategic purchasing to make sure that it balances its role in providing the needs and of course making sure that the resources are available. One major example that we can produce right now is also making sure that we have a proper and of course a better provider payment mechanism, which we hope also will help change the behavior not only of the patients but also of the providers themselves. Right now, we are working to make sure that we will shift to a prospective payment mechanism. Right now, we are looking into having a DRG system with a payment mechanism putting a cap of a global budget. This way, we hope that the providers will make their operations more efficient, thereby also in having a global budget, it would make them strengthen their primary care to make sure that they have more economic gains. This will also support the environment that is being put right now by the Department of Health, being the primary care as the initial point of consult. But what is good right now is, again, as I've said, the law provides for the enabling environment for us, PhilHealth, to make sure that we purchase strategically. So, for example, in the areas of medicines, the law also provides that there should be price negotiation board, that the services, especially on medicines, that the services now that will be paid by the national health insurer will have to go through a technology assessment in order for us to make sure that these are cost effective, and all those will have to go through assessments. And so we hope that the funding that would be coming from the government and of course from the premium contributions through our strategic purchasing means, we can provide and we can improve the way our patients like Gina or all the members of PhilHealth will have a better, will be more financially protected in times of ill health.
Thank you so much. And you're outlining a whole range of measures that now are being put in place based on the Universal Healthcare Act. So that's good to see you've got a big responsibility on your shoulder. We will see next year for World Health Day how much the situation has changed. But I think there are important things, of course, that everybody is now part of PhilHealth. It's important that more is being spent and the depth of coverage, we say, is bigger so that patients indeed don't need to have substantial co-payments. But also you've mentioned the important function of creating incentives that services are better working together, because at the end we are looking at a networking of services, because only people will use primary healthcare if they feel confident that if they go to a primary healthcare provider, through this primary healthcare provider, they can access the whole range of services, and including then tertiary and secondary and tertiary care if needed. And that will need provisions to make the services interface much more efficiently, and financing is a very important instrument to make that happen. I'm a little bit conscious of time here, and I'm getting already looks here from Liv. But maybe let me just so briefly summarize what we've heard so far. So we hear universal health coverage is critical and has two dimensions. There's the access to services, and based on a very strong primary healthcare approach, which is at its centers, which helps the patient navigate the system and not get lost in translation somewhere. And secondly, affordability of services, of course, so that there's no undue hardship to patients, because any cash payments will drive people away from healthcare and not drive them to health services. So both are addressed in the Universal Health Coverage Law, and that's, I think, why people are so excited about that law and the opportunities. But with that, maybe thank you for the Philippine perspective. I also want to still turn briefly to our two ambassadors who have volunteered to comment from a perspective outside of the Philippines. And maybe Ambassador Wahab, I can start with you from Brunei Darussalam. And we know that Brunei has made very important steps towards strengthening primary healthcare over the past years. And I wonder whether you want to share a few of those steps or experiences along the way.
Thank you, Dr. Wheeler, and very good morning, Excellencies, ladies and gentlemen, and happy World Day, Health Day, everyone. The health services in Brunei has undergone significant progress over the last century, and more so during the last 19 years, where primary healthcare has emerged as one of the health system priority. Primary healthcare development was set as a high priority in our National Healthcare Plan 2020 and 2010. A result of this, the centralization of the primary healthcare from the hospital-based care to the community-based care in health centers was set up throughout the country. This included the development of infrastructure, the enhancement of quality of services, as well as human resource development. Primary healthcare services continue to be integrated in the strategic plan of the Ministry of Health, such as the Ministry of Health Strategic Map Vision 2035, which was published in 2010, and then in the Health System and Infrastructure Master Plan of Brunei Darussalam Framework in 2015. The commitment of the government towards primary healthcare in the country and universal healthcare coverage is reflected in the achievement of the country in the Millennium Development Goal. The country is also on track in fulfilling the targets for the Sustainable Development Goal, the SDG. For example, The maternal mortality rate, the MMR in Brunei, has shown a marked decline since 1960s and now is a low ratio. This can be attributed to the highly accessible reproductive healthcare, excellent immunization program, as well as high percentage of deliveries in hospital by skilled health personnel. For the under 5 mortality rate, Brunei has been able to gradually reduce this over the years. The current challenge is to achieve further reduction. The National Immunization Program has achieved immunization coverage for more than 95% of children under 5 years immunized every year. We have also implemented the HPV vaccine program as part of the preventive approach to protect the female population from cervical cancer. Brunei has been declared malaria-free from the WHO in 1987, polio-free in 2000, measles-free in 2015, and rubella-free in November 2018. In terms of infrastructure, there are 14 comprehensive health centers, 4 health clinics, 2 flying medical services, and 3 traveling clinics in Brunei. The comprehensive health centers are in line with the concept of one-stop health centers that provide integrated care services under one roof, with the intention of improving the quality and also the efficiency, as well as more comfortable and conducive environment that are closer to the communities that they are serving. The healthcare system provided in the country is consistently trying to respond and be prepared to the complex health issues. The importance of health promotion and disease prevention is taken seriously with the emphasis on people-centered approach. A new national health screening program has just recently been launched for the early detection and prevention of non-communicable diseases. So in conclusion, we are committed to strengthening primary healthcare as part of our healthcare system. This is in line with our Vision 2035, that is the attainment of high quality of life of the population, and also the Ministry of Health Vision together towards a healthy nation. Thank you.
Thank you, Ambassador. Thank you so much. And you might recall in the graphs that we've seen in the beginning that Brunei was all up there, a very strong economy. And so it's interesting to see that you are equally committed to primary healthcare, and you're talking about some of the results based on the primary healthcare approach. So we're not looking at primary healthcare as a second-class care for poor countries, but this is really the backbone of good care in all settings. And so Ambassador Robinson, of course, Australia has an excellent primary healthcare system, so we don't want to delve into this, but interestingly, Australia has also made it a priority to support other countries in strengthening their health system and specifically primary healthcare system. And I wanted to ask you, why does Australia think it is important to invest in development assistance specifically for primary healthcare?
Thanks very much, and good morning, ladies and gentlemen, and happy World Health Day. Lovely to be here. Let me start by saying that Australia is really strongly committed to helping progress universal health coverage. And it's pretty obvious why. You don't have to really be a brain surgeon to work this out, because healthy and productive communities are the foundation for social and economic development. And as you rightly mentioned, in Australia, we are really lucky. Our own health service system prioritised the principle of universal coverage by providing access to all citizens. And that means they have free access to public hospitals and affordable access to a wide range of medicines. And with that in mind, I'd like to applaud the Philippines on its new universal health care law. That is a tremendous achievement. Because the principles of universal coverage are an underpinning to Australia's approach to development assistance in regard to health. And our Foreign Policy White Paper of 2017 is very clear about the importance of strengthening health systems to promote healthy, productive populations and combat existing and emerging health risks. Because strong health systems protect people from the financial consequences of ill health and enable people to participate in decisions affecting their health. Health systems also need to be able to respond to unanticipated health emergencies without limiting the care required for people's day-to-day healthcare needs. And that's particularly pertinent in a region where there are existing disease burdens such as malaria and TB and periodic outbreaks of diseases like measles, combined with an aging population and chronic conditions that require frequent use of health services. So primary health care is the pathway to achieving universal coverage because it is the first point of contact for people seeking health services. An efficient primary health care service reduces the need for more complex and costly intensive care when health conditions become more acute. And I'd like to give you a couple of examples of how we work with partners in the region to strengthen primary health care. In Timor-Leste, Australia supports the health sector with a focus on improving maternal and child health. Our support is targeted at reducing pregnancy-related deaths and improving women's access to health clinic and services. We also support improved access to quality health services in Cambodia, including for reproductive, maternal and neonatal care in underserved remote provinces. And the Cambodian government has worked with development partners in recent times to ensure that the poorest 20% of Cambodians now have access to free essential health care, and that's a tremendous achievement. Across the Indo-Pacific region too, non-communicable diseases such as heart disease, diabetes, cancer, now represent the largest disease burden and are the most common cause of premature death, particularly in the Pacific. So since 2009, we've been working and supported Tonga's Ministry of Health to improve primary health care services with a focus on NCDs, which accounts for 83% of all deaths. That's an alarming statistic. At the heart of health systems strengthening is the planning and budgeting to resource and deliver health services. So many countries in the Indo-Pacific are disproportionately reliant on donors to finance specific disease and immunisation programs. And a key challenge here in our region is the ability to transition from externally financed health programs to sustainable domestic financing. So Australia and the World Bank have invested in a multi-donor trust fund on integrating donor-financed health programs to support 12 countries in the region to enable them to strengthen their health systems to accelerate and sustain progress towards universal health coverage. In Indonesia, in particular, a health financing assessment supported by the fund directly informed the National Strategic Plan and helped address key health blockages such as purchasing TB services and the provision of HIV/AIDS services, and was used to inform a new World Bank loan for primary health care reform. In Vietnam too, the fund supported the government to invest in a health sector loan to improve the efficiency of the community health system to adapt to the multiple social and economic transitions occurring. So to finalise my remarks, strong and resilient health systems, efficiently managed and sustainably financed, go hand in hand with a safe, prosperous and secure region. We look forward to continuing to work closely with partner countries in the region and with international development partners on this important agenda. Thanks very much.
Thank you, Ambassador, for making this very eloquent case for primary healthcare, like a brain surgeon, and for also showing how countries can really work together and support each other in supporting primary healthcare. So I think we are coming to the end of the panel, and I don't think there's a need for some kind of formal round of closing remarks. But maybe I would like to just give it back, Ms. Gina, to you, because at the end, World Health Day is all about the people that we serve. So maybe just one last very brief question. Why do you think primary healthcare is important? Why should countries in this region focus on primary healthcare from a patient perspective?
I think it's really very important, especially with those with disease, like NCDs like me, because it will help us live to our fullest and be more caring with ourselves. If we are being provided with a lot of for the health needs, if we are being provided by the government, or it will be a program for us, we will be able to manage our disease.
Excellent. This was a very good, very great concluding remark, really. There's not much to add. It's all about helping people to remain healthy and to manage their disease if they have one. Universal health coverage means primary healthcare services for everyone, everywhere, as we've heard, with no financial hardship for the people, but with a huge gain for our societies. So thank you very much for those perspectives, and happy World Health Day from me as well.
Thank you so much, Gundo, and thank you very much to all of our panelists here today. So this concludes the formal program for this morning. So thank you so much to our friends from the diplomatic community and other partners and guests for being here to help us celebrate World Health Day 2019. Now, our campaign to promote universal health coverage, and in particular primary healthcare, doesn't stop today. UHC, or universal health coverage, is central to WHO's mission. And we hope that all of you will join hands with us and continue to work towards the goal of health for all.